I'm Dr. Mitchell Shankup. I'm an orthopedic surgeon.
Dr. Mitchell Scheinkopf is a joint replacement pioneer. He helped introduce knee implants worldwide. He performed the first knee implant ever in Morocco. But Scheinkopf is also an avid skier. And when it came to a knee implant for himself, his answer was no way.
I think the real indication for a knee implant is when you're ready to sit down in a wheelchair.
Dr. Scheinkopf had seen most knee implant patients give up their active lives after a knee replacement. Over half regretted having the surgery. Instead, Dr. Scheinkopf turned to new biological, non-surgical treatments that have enabled the 73-year-old to stay as active as ever. Dr. Scheinkopf realized there were millions of people just like him, people who wanted to eliminate or delay the need for joint surgery. So this pioneer in joint surgery became a pioneer in something else, delaying joint surgery.
It is a disaster for a 40, 50-year-old, even a 60-year-old to have a joint replacement. Younger patients are having too many joint replacements too early in life.
Dr. Scheinkopf has founded this Chicago center called the Center for Orthobiologics.
Hold them here. Don't let me push down. We're checking your strength, and I want you to hold them here as hard as you can.
Ron Ramirez has also avoided a premature knee implant. The retired firefighter was first advised to have a right knee implant in 1995, 20 years ago. He also said no. You ever think of you taking that advice?
Yeah, I'd be in and out. I would have had my probably second or third replacement.
2 years ago, as Ron researched ways to keep avoiding an implant, he came across the name of Dr. Scheinkopf.
I mean, come on, 40 years doing replacements?
You knew this guy knew what he was talking about.
Yeah.
Ron's benefited from a new procedure called Regenix. His stem cells were taken from his bone marrow and then injected into his knee. That was almost 2 years ago.
I was back at the health club 3 days later doing upper body, and I was in the pool working out.
And has it been lasting relief?
It has been.
In fact, last summer, Ron built this entire deck by himself on his hands and knees. Dr. Scheinkopf has done the Regenix procedure over 600 times.
As an orthopedic surgeon, I have the largest number of patients completed.
For patients whose joint damage isn't quite as bad as Ron's, this center has pioneered another revolutionary treatment. This one derived from the amniotic fluid taken just before a normal cesarean section. A healthy newborn's placenta contains fast-growing tissue cells that can also protect and perhaps restore damaged joints. Jennifer Richards is about to have an injection of those tissue cells into her knee. For the last 5 years, she too has successfully avoided a knee implant.
I've been told that I wouldn't be able to ski with a knee replacement.
You can't tolerate that.
There's no way I can tolerate that. And I have an 11-year-old daughter, so I have a lot of years to chase her around.
A quick injection of processed amniotic cells will keep Jennifer young, active, and away from surgery as long as possible.
Done.
Thank you.
She's a candidate for a high quality of life, and she's entitled to live such without pain and maybe reverse the arthritic process.
Bob Winslow's skiing and rugby playing has caused his knee swelling. And again, 2 years ago, surgeons said he also needed a knee implant.
And probably would have done that with Dr. Scheinkopf before he started doing this.
For Bob, Dr. Scheinkopf chose yet another treatment, an injection of joint-preserving proteins taken from Bob's own blood directly into his knee. The result of his treatment? Bob still skis aggressively, fly fishes, and bikes 50 miles.
And I'm, of course, doing things I couldn't do with knee replacement. I think people ski with knee replacement, but they don't ski intensely.
But the Center for Orthobiologics collects more than just testimonials. Every patient here is followed up. Researchers measure their treated joint size, strength, patient's pain, their range of motion, and sensitivity. The goal is for the first time to objectively determine which treatments work best for which patients.
We document both subjective and objective findings on all our patients, and one of the key things we look at is what their activity level is.
At this point, some of these treatments aren't covered by insurance, but to Jennifer, that's secondary.
What I had isn't covered by insurance, but I think it was worth, paying something now rather than having a procedure at my age, a much more expensive procedure at my age.
When it comes to a knee replacement, Ron is even more emphatic.
Don't do it until you investigate this Regenix therapy that's being offered.
The Center for Orthobiologics is becoming the epicenter for the new revolution in orthopedics, and the pioneer who helped introduce knee and hip implants to the world is now helping active people like himself postpone or even eliminate those procedures.
My thrust of my practice is exactly what I want done for myself, and that is keep active, stay fit, and postpone the joint replacement as long as possible, perhaps forever.